Have you been watching your weights and workout times get slowly worse? Is your hip or low back pain causing you to miss workouts or sit out when certain movements are programmed? And you don't want to resort to scaling, taking pain pills, paying for a membership that you can't use, or even surgery? Keep watching as we go over some common causes of pain, treatment options, and a great warm-up to keep you in the gym and feeling strong as ever.
All right, Dr. Jake Shockey here. So let's get started with a little bit of an exam for what we're going to look for. So the first thing we're going to check is for good IAP, or inter-abdominal pressure. So we can do this by first checking the patient just in a seated position. And what we're going to ask the patient to do is just breathe into my hands. So I'm placing my hands just kind of right underneath his rib cage. So what we're looking for here is that when he takes his breath, we're not watching the shoulders and the chest rise, but instead he's kind of filling up his abdomen, pressing out 360 degrees in the front, on the sides, and then even here into the back. Something else that we can do then is from this position, we can ask the patient to lift his left leg up off the table and just watch to see how he stabilizes. Okay, you can drop your left leg. Now let's try it on the right. So we're going to check for any imbalances there and just see if he's shifting one way or the other, or if he's not stabilizing properly on each side. So let's have you go to your back. So another way we can check this is in a supine position, and we can have the patient, we're going to bring the knees up. So we're here. You can place something under their feet, you can hold them, but basically what we're going to do is just ask the patient to just breathe normal. And again, we're going to have him put one hand here on his chest and then one on his belly. So this hand on his chest should not move at all. The hand on his belly is going to be going up and down, filling up with inspiration, dropping with expiration. And then we should have the low back flat against the table, which I can check here with my hands. And we're just going to look to see to start to train just proper respiration from here. From there, we can work on trying to learn to teach that brace that we so often need with other movements. The next thing we're going to check is mobility in the foot and ankle. So if I could have you scoot up towards the head of the table a little bit. Perfect. All right, and then just let your feet hang. So when we're talking about hip and low back pain, oftentimes the pain's going to be felt in the back, but what we want to do is make sure that the hip is functioning properly and moving correctly, and then also in the ankle, because it can go up the chain. So the biggest things we're going to check here are big foot or big toe dorsiflexion to make sure that it's equal, symmetrical on both sides, and that he's getting enough of it. The next thing we'll check is just calcaneal eversion to make sure that he can just evert the calcaneus through his gait or when squatting, running, jumping, and the like. Then the last thing that we'll check is just midfoot dorsiflexion. So we'll just check to make sure that the midfoot joint is able to dorsiflex properly and give him the range of motion that he needs. If he doesn't have one of these ranges, he's going to chew it up and get it from somewhere else, oftentimes the hip or the low back. In a second, we'll show you another way to check ankle dorsiflexion to make sure that it's symmetrical and that he's getting enough of it. Let's jump to the hip. So for the hip, the first test we're going to do is the Faber test, basically just crossing the patient's leg, letting his knee drop, and then we can give a little bit of overpressure. We say, Mr. Jones, do you have any pain with this? Sometimes the patient may exhibit a little bit of pain near the SI joint or posterior hip. But what we're doing is just looking for symmetrical movement here, making sure that his knee can just drop to about the same spot on both sides, and then it's a pain-free movement when we give a little bit of overpressure. Next, we'll check fader. So we're going to flex the hip up, internally rotate, and adduct. And he shouldn't have any pain with that. If there was pain there, that could be signs of a hip impingement. Basically, from where the femur is inserting into the acetabulum, something's not moving quite smoothly, and it's giving him an impingement. So that's our fade air test, and the last one that we're going to do is just a hip scour. So we're going to basically come up here, and we're just going to check the entire range of motion of the hip in that hip capsule or acetabulum. And then I should be able to feel there if we have any kind of lesions on the head of the femur or inside of the acetabulum that are going to be pain generators or lead to any further pain. All right, so here we're going to be checking one more test to just check for overall ankle dorsiflexion. This is a great test, pretty easy to do. You're just going to have the patient step up to the wall. We're going to have them put about a fist distance from their toes to the wall, and the back foot is just going to stay flat. The front foot is going to stay flat, and what we're going to ask him to do is, Mr. Jones, just try to take your front knee as close to the wall as you can. So what we're looking for is to see if he can get to that wall and touch his knee without his heels coming off the ground, which he can. So he's going to return to the starting point. We'll switch feet and do the same thing. So making sure that we have the same distance. And we're going to try and see if he can get there without the heels coming off the ground. And he's very, very close. Maybe a slightly limited here on the right side. So we can see a little bit of imbalance. Not much for him, but with a patient that has a true imbalance, this should stick out kind of like a sore thumb. All right, so here we want to check for lumbar flexion in the squat. So we're going to kind of see what his range of motion looks like, what the low back's doing, and if he's able to control things on the way down. Oftentimes we hear of a butt wink or basically a rounding of the lumbar spine. And depending on who you talk to, they're going to tell you that this is not something to worry about, but under a larger load, this is definitely something that we want to worry about. We need to learn to start to squat with a neutral spine and control that spinal flexion. And an easy way that we can do this is just have the patient squat. We'll take them through some ranges of motion here. So we're going to do this unloaded, no bar. You could add a lighter kettlebell or an empty bar just to add a little bit of load to see what it looks like. So we'll show you a couple different angles here. So we're just going to have the patient set themselves up in a nice squat. And then if you can, Mr. Jones, we're just going to go through three squats. So what I'm doing here is just checking to see what the feet are doing. Are his heels coming up off the ground? What are the knees doing? And then obviously I'm looking at his low back to see if he can get to a good depth without losing the angle of his spine there. So if you can, let's face that wall. And then again, we're gonna look here just to make sure that he's able to maintain a neutral spine. So go ahead and show us a couple bad reps. So you can see as he gets lower and lower and lower to get that bottom depth of the squat, he starts sacrificing his lumbar spine and it starts rounding over. Even just that slight little tuck of the hips underneath is going to end up costly down the road in rep after rep. You can probably get away with that if you're only squatting, 135 pounds and you're only doing it a few times, but if you're truly chasing strength or you do it over and over and over, eventually it's going to cost you. So the next thing we're going to do is just check for some hip control, and we're going to do that with a 6-inch step down. So we've stacked up a couple plates here. What we're going to do is ask Mr. Jones to step up onto the plates, and then he's just going to lower his heel down, tap his heel on the ground. What we're doing here is just checking the hips to make sure that they're staying level. We're watching the knee, and we're seeing if he can control his descent and then return to the starting position. So on his right leg, he's looking like he's doing pretty well. So we'll have him switch, and he's going to repeat the same test. Very good. So Mr. Jones, show us what a bad rep would look like here. So we see the knee start to dive in, loss of control there at the hip. Okay, obviously he loses everything right there. So there we have a 6-inch step down. We're looking for hip control. through some ranges of motion there. So after we've examined and assessed the patient here, some of the treatment options that we have are just some soft tissue work. So right now we're going to take him through a little bit of an ART soft tissue release here for his glutes. So I'll pin him down and then I'll say, Mr. Jones, what we're going to do is take your leg off as far as we can and then try and get it as close to the ground as you can. And then we'll repeat. So he's going to take control of that and I'll keep working here on the muscles, really going after glute medius and glute minimus as he tries to get to full range there. So really here we're going to go for 5 to 7 passes, and then we would switch sides if needed. Another treatment option that we really like to do, especially if the patient comes in a pretty hot kind of state or a hot low back, is we would just flip the patient over, have them lay on their stomach, and then we could just do some dry needling to the hips or the lumbar erectors just to kind of calm those muscles down so that we can continue treatment. Another thing that we love to do is really stabilize the hips with some of our DNS principles. You can check out some of the other videos on my channel to see a little bit more about what that's all about. So lastly, we're going to have him roll to his back. And then we're going to show you one adjustment here is a good adjustment. Patients love this one, and it can really just kind of free up the hip, especially like in the posterior hip capsule. So the first thing we're going to do is just kind of palpate the posterior hip capsule here. So we're going to roll him over, slide the speeder board under, and then get a little more tension on there. Big muscles. Let's try that. And then again, just like the ART, we can go through a few passes there. Anywhere from 5, 6, 7, 8 passes, just to kind of get a lot of repeated motion into that joint and that posterior hip capsule to help kind of free things up, can be often very beneficial for these patients. So stay tuned. We're going to go over a quick warm-up on what you can do to just kind of get the low back and the hips firing correctly before you work out.
you.